Hello and welcome. I'm Beau Simmons, editor of the Stillwater News Press, and this is In the Newsroom. Joining me today is news editor Tanner Holubar, city editor Michelle Charles, and reporter Ashlynd Huffman. Thanks for joining us today. We go a little bit over our past week, talk about the stories we're working on, and then we'll talk about a few things we have coming up. One of our top stories this last week is just sort of a retrospective, really breaking down the timeline of what we would consider our pandemic anniversary. We know that COVID-19 was discovered long before it ended up in Oklahoma, but we sort of marked our anniversary as the first Payne County case, and Michelle looked really back on a lot of her own coverage to create this timeline. So what did you find out, and what would you say are the most important parts of the timeline and the things you wish you could have gotten into the timeline if you'd had a little bit more space for that?
Well, first of all, I mean, we kind of decided to hone in on the first case that was diagnosed in Payne County, which was March 15th of last year. A lot of people did coverage of a year of COVID, right? And we all kind of a lot of people pegged it to the Oklahoma City Thunder game that was stopped, because that was kind of when people went, oh boy, this is real. But in Payne County, we had our first case identified on March 15th, which was pretty early, actually. There were when I looked back, I was surprised. I had kind of forgotten that there were only 7 cases in the entire state. So we were pretty early on to one of the first places where it spread outside of the big major metro areas. And of course, a lot of that, maybe our population, we don't know exactly what it was. We have people who tend to travel more. We have people from all over the world. We have a large younger population, which is pretty mobile and very social. So that was one of the big things. So anyway, that kind of kicked it off for us. Let's see. So we had March 15th. By the 16th, the governor had declared a state of emergency across the state, basically the next day. And then the day after that, Project Heart, the senior nutrition program, shut down. And this is a program where a lot of older folks go every day during the week to get their lunch and also for social contact. They have been doing basically drive-through curbside delivery for an entire year since then. They were able to get up and running pretty quickly. But I mean, looking back at this, I was shocked at how long the list of emergency declarations was. There were periods where they were being updated, or new ones were being put out. Okay, almost every couple days.
You're talking about coverage of when someone had to put something else out to either it clarified something, or maybe it changed what was going to be closed, or
exactly it addressed something that had not been addressed, or dealt with included maybe new businesses or whatever. On March 23rd, there was an emergency declaration that shut down the non-essential, and I'm using air quotes. You can't hear them, but I'm using air quotes. Non-essential businesses like beauty parlors and salons and spas and gyms and things like that. They were shut down for about a month. By May 1st, we had made national news because of the mask mandate that lasted for a grand total of about 18 hours, which was through an emergency declaration. The city council would then later come back during the summer and put in place an ordinance that, it was kind of like spreading out the, not necessarily blame, but it's something where I believe they were making a statement that said, we all think this is important. The city as a whole thinks this is important. This isn't just the mayor telling you this because he wants to.
Interesting looking back, though, because I think there were a lot of people who are trying to say, almost take credit, like we've had these in place before anyone else, and I was thinking, it's like, I think Stillwater did too. It just didn't last very long. Right.
That's exactly right.
I think they were really early on in the pandemic and a mask mandate.
We were.
And then it got shut down after,
we had one before
about
Norman.
a day, 18 hours,
Yeah, we had them before anybody. I mean, the thing is, all across the board, if you remember this, our local city government was working very closely or talking very closely to the mayors in Oklahoma City, in Tulsa, in Norman, in the other major cities in the state. And in a lot of cases, we were running a couple of days ahead of all of these others. I don't know if it was scheduling because our councils just met sooner or what, but it always seemed like we were kind of leading the way on a lot of this stuff, which unfortunately, you know, when you're leading the way, sometimes means you're the one in the line of fire.
And honestly, I think that it was so long ago, it was before a lot of the anti-mask momentum even began. So it was more of a gut reaction, I think, for people, you know, people who had already gotten there, told they had to do something, and then it was like, what are you talking about? Because I don't watch the news, or I don't read the newspaper or something. So I think, I mean, a little bit of that Q stuff was already bubbling around, you know, in social media and things like that. But yeah, I really think when that happened, and what we're talking about, I don't know if we've been totally clear, was mask mandate declared in, you said, early May.
Yes.
And then almost immediately it was, I think, retailers saying people are freaking out about this and threatening our employees.
Right. It went into effect May 1st. And by the next morning, by the next afternoon.
Calling the police is what they were doing.
Yes.
And then Stillwater said, we don't think we can police this, right? That
exactly.
was sort of the,
well, and also the thing became, is it fair to ask someone, to ask the door greeter at Walmart or some other store to enforce this when they're going to get everything from verbal abuse to physical threats? And there was even a call made to City Hall that threatened some kind of violence. So, I mean, it got pretty extreme. So that didn't last very long, but it came back later in the summer as we were preparing for the students to come back at OSU. And of course, that's when we had a pretty big surge at that point. The numbers started going a lot higher as soon as the OSU students came back around mid-August, August 17th. You know, and that was the week that, again, we made national news where there was a video that was circulating of a bunch of students without masks partying on the dance floor of a local bar the weekend before school started. So we do tend to make national news in Stillwater more often than most people would think. It's kind of surprising.
I think more often than a lot of towns of 50,000 people, right?
It feels like it. Yeah. It definitely feels like it. I mean, you know, and by September 28th, Stillwater Medical Center was in its surge plan because every hospital in the state had to come up with a surge plan. It's like when the cases start to get to be more than we can deal with, when we have to increase our capacity, what are we going to do? So by the end of September, SMC is there. They're having to plan for that. By, let's see here, in February, by February 25th, Stillwater had recorded, okay, this is the other thing I want people to remember, is that through June, we only had like 22 total cases in the county. By February 25th, we had 4,948 confirmed cases and 23 deaths. That's one more than the total number of cases we had for a long time. So once things started progressing, they progressed really fast.
Right. And it was really that, yeah, all these headline-making things happened before October, but the pandemic really swelled for us, and I think for most of Oklahoma, December, January, February, right?
Right.
And
right,
that's like,
absolutely.
And that's just, and then it was damage control and just making sure we didn't completely lose access to the hospital.
Oh, absolutely. December 21st, we reported that Stillwater Medical Center was converting a conference room to additional patient care areas because at that point they were having to hold COVID patients in the ER for so long that they didn't have space in the emergency department for people with other illnesses who are coming in. And this is the kind of the key to making sure that your hospital capacity doesn't get overwhelmed, right? Because there's not room for someone who's having a stroke or a heart attack if it's full of COVID patients as well. It affects everybody. So we found out that they were actually converting a conference room that was near the emergency department to patient care space where they could basically keep COVID patients, so that they could have room in the ER for people with other types of emergencies. And that was December 21st, which wasn't that long ago, folks.
And we'll come back to this, I think, and when we'll talk a little bit later about what we have coming up, because I know you've spoken to some people there at Stillwater Medical, and just to say that even if the pandemic, even if it didn't affect you, they were living in it over there, right? I mean, even if you were fortunate enough to not have a family member get sick, and maybe you went your whole time without a mask and did what you wanted, I mean, I would say to that you were lucky, but for those at Stillwater Medical, not so great. But yeah, I think before we can kind of come back to that, we'll just move along so we can cover a few other things. Tanner, I know we had talked a little bit about events, what's coming up, what's canceled, but you had specifically spoken about, what did we call that? The Pandemic Prairie Benefit? What do we call that?
The Prairie Pandemic Relief Concert Series, basically put on at the Stillwater Community Center through the, I think it's the Friends of the Community Center over there. And basically they started this concert series, I think, last year, or may have even been earlier this year.
It's kind of more of a novel idea. Like they'd had free shows, not this particular group, but they'd had free shows at the community center before, but this was something specifically to address artists in music industry that had been hit by the pandemic, right?
Right, yeah, that was kind of the goal behind the whole thing, is that they were trying to just, help any way they could, really with all these artists who really had a lot of shows canceled, had a lot of things canceled. So, but with this week, their proceeds are going toward the family of Randy Blake, the firefighter who has been battling COVID-19, and so that's just kind of a cool thing. It's just another local fundraiser that, they try to give money to any charitable or, avenue they can, to people who really need it. So I think it's just a great, it's kind of a cool other local fundraiser that happens to be live music and live entertainment.
And you've looked a little bit at the schedule. So who do they have coming and what's the next thing for them, the next act?
Well, I know tonight it's a group called the Vintage Wildflowers. It's a trio of women from Tulsa. I guess they're kind of a folksy Irish group.
Which will have already played by the time people hear this.
Right.
So you got to think in future times.
I don't know who is
Oklahoma
next.
State Jazz Band is the next one.
Oh, cool.
And they're going to be benefiting Our Daily Bread next month.
Yeah, so just different acts for different causes. And
right, and these are
cool.
things where, they're concerts that are broadcast online, and they have a virtual tip jar that usually goes toward the organization that's being supported. And I think they do 20% of the ticket sales go to the, whichever way they want to donate it as well. So it's a great way for people in the community. If they're interested, they can check out the, I think it's the Ocali from OSU broadcasts it. So, and information can be found I think it's StillwaterCommunityCenterFriends.com, like sccfriends.com. So there's a lot of information about their schedule, about all the links and all that good stuff, if anybody's interested.
All right, very cool. And I did get some heartbreaking news, which I didn't even realize, and that is that the Blaze-a-thon is not happening this year, and maybe not again, which was my favorite event. All I know, I still got to figure out exactly what they have going on. I can say it's not happening this year for certain.
So you've got to figure this out so you know how to live the rest of your life, is what you're saying.
Yeah.
Yeah. He was going to go to Kansas City barbecue
Am I
judging school.
Have to smoke my own meats? I don't know. But yeah, the Blaze-a-thon was a barbecue competition and fundraiser for kicking childhood hunger. for a few years now, but yeah, it happened at the Elks. Used to put that on. Oh, moving on. Ashlynd has not been here in the newsroom with us because she has been at court mostly. Not for something that she herself has committed, because she's covering different cases. It's really just kind of trial season, right? I mean, how does that work? How does the scheduling of trials work? We know, I mean, like everything else, it was postponed or suspended by the pandemic, but it does sort of happen in a rhythm, right? I mean, all these things sort of happen kind of at the same time.
The judge has been determining cases that would be first up, second up, third up. So as of now, there's multiple trials on one date set. And so if the first trial pleads, the second one would go. So it just depends on if anybody takes a plea deal before their trial. There was one that pled guilty last week, and so that's why my trial was pushed up to first up. So if they had not have pled, I would not have had my trial.
Maybe just the general public may not understand, and I wanted to ask you about was jury scheduling, the jury pools, and you know how the jury selection process works. Because I'd always kind of figured that you're selected for a jury pool, you go up there, and lawyers or judges will sort of determine your worthiness, and that would be for a certain trial. But you could be selected during the jury process and then do multiple cases, right? You could sit in on multiple cases.
Yeah, you would be on the jury duty for 2 months. So the month of March and April, whoever served on the jury from last week could technically start serving at the end of March. So they could be eligible for any of the trials in April. So usually voir dire starts around 9 a.m. and then everybody goes into the courtroom. And the lawyers, the defense, and the state will ask specific questions. So if it's a case that involves a gun incident, they'll say, has anybody been a victim of gun violence? If you've been a victim of gun violence, you're cut. So it's very, very specific.
Right. They don't ask you if you're a member of the NRA or if you own a lot of guns. What they would rather they want to know.
They do ask stuff like that, and then they ask at the beginning. They ask how old you are, if you have any kids, if you're married, and what kind of job you do. If you are a nurse and there's a lot of medical testimony, they will cut you. They don't want a nurse on the jury with a lot of medical testimony because during deliberation they might say, "Oh well, I know more about this," and sway the jury in a different way.
So the whole idea is to not have a prejudiced jury, someone who has any kind of information about the case.
It's very tedious. It takes several hours.
Well, what kind of thing would keep someone off a murder trial?
Usually in those cases, one of the things is, can you put someone in prison for the rest of their life? And if you say you can't, then you would be cut. Because potentially if you face a murder charge, you can serve life in prison, death penalty, or life without parole. So if you can't do that, then you won't serve. So
watching hundreds and hundreds of hours of true crime shows on Netflix doesn't prejudice anyone from the jury pool?
I don't think so. I hope not.
That's going to be the next. Attorneys will hear this and they'll be like, yeah, we should look into that.
They did say they don't want anybody that's ever been a victim of a crime. So if you've been a victim of a crime, you most likely will not get to do jury duty.
So I've got a question.
Okay.
How did it compare to, you watch a lot of true crime shows, and we've all seen Law and Order and we've seen all those things. How did actually sitting in a courtroom watching a trial compare to what you've seen on TV?
It's disappointing, honestly. On TV, it just seems like the victim gets more justice than they really do in court. So it is very disappointing.
Very good.
More justice, less justice.
Less justice. More tedium, less justice.
Yes.
But there are a lot of objections, right? I mean, yeah, that stuff is real. If you're sitting in court, you will hear.
It depends on the lawyer. I've had some that I was like, oh, they didn't object to that. But then I've had some that object at small things. And I was like, okay.
Do you see the strategies as they're laying them out? I mean, can you kind of go, oh, I see where you're going with
I
that?
do. I can pick up on the strategies for the most part. Usually I know what they're going to argue beforehand, but sometimes I don't even think personally there's enough evidence for certain crimes or, charges. So people ask me, hey, do you think, that the jury's believing all this? And I'll always be honest. Sometimes yes, and then sometimes no. So it just depends on the evidence.
All right, I'm going to stick with Ashlynd because I had also talked, I can't remember if it was last week or the week before, how I said I wanted to look into state questions 780 and 781. And usually when I say I want to look into something, I mean I want one of my reporters to look into something.
Really?
Yeah. And
that's what that means. I kept wondering why you were doing that story.
And so we gave that to Ashlynd, who kind of had to do a little homework just on 780 because you were still in college when that went through. That went into effect July 2017,
that was,
right?
Yeah. I had actually just graduated college graduated high school when they were talking about it. And so it started when I was second year in college, but I didn't pay attention to that stuff back then.
And for those unfamiliar, those were the state questions that is really the most sweeping sort of criminal justice reform bills that I think we'd ever had, or not bills, state questions, state propositions that voters in Oklahoma passed. 780, which decriminalized, or no, not decriminalized, but just moved from felony to misdemeanor, a lot of drug possession crimes, a lot of theft under 1,000 kind of crimes, and a few other things. But what else is wrapped up in 780? So mainly that.
Yeah, pretty much. Just like simple possession, theft. But when you think about it, theft under $1,000, you could take someone's iPhone and then you could technically be charged with a felony because iPhones are like $1,000 now. So.
Right, whatever something is valued at the time.
But it used to be $500, so now you get like an extra $500 to steal.
But there's also a difference, though. I mean, but if you break into someone's car and take that phone, if you break into someone's house and take that phone, well, that's a different charge. So then it isn't simple, theft under 1,000.
Yeah.
But the other part of that, when everyone voted on it, was 781 was supposed to take money saved by, it was kind of theoretical. Even when we voted on it, I think we knew that it was a theoretical idea. You would take money saved by people not being in prison, by people not having to be prosecuted, and all these kind of things. And we were supposed to take a chunk of that money, and that money was going to go to rehab facilities. I mean,
from what I understand, it was supposed to go to different counties to fund substance abuse and mental health programs. So kind of like drug court and stuff like that, from my understanding. I talked to Chris Still. I can't remember his exact title, but he said that there is money that has been saved that's supposed to go to 781.
Chris Still, former speaker,
yes,
and now works on criminal justice reform, was a big part of the push for 780 and 781.
Yes, that would be him. So he said that there is money, but the legislator has not appropriated it into the 781 fund. That is the problem that we're having.
He's saying there are savings.
He said
tangible savings.
If I remember 100% correctly, the one for 2020 is $10.6 million.
Okay, so him and his think tank, they're telling you $10.6 million has been saved, but our state legislature has not moved any of that money from 780 into 781.
Yes.
So counties have not seen a single red dime.
And I have spoken with Roger Thompson, who is the chair appropriations for the Senate, and he's meeting with DOC today to talk about, they're coming up with a new plan.
We're recording this on Thursday, just Thursday, I don't even know what the date is, Thursday, March 18th.
So he's meeting with DOC today to discuss how to go forward, basically. And Chris said that he's very hopeful that by 2022 that they will have the fund up and running.
Are they doing that because you called and scared them?
No.
Were they not going to do this unless you?
No,
made
Chris
this phone
said he
call?
was very happy
Okay.
that we reached
Right.
out, because the recent rollbacks and everything. But I don't know about if Roger Thompson was scared. I don't think so.
It
But
wasn't the pressure you
he
put
didn't
on.
seem scared.
That, like, ooh.
But-
Now that the reporter is calling me, I guess I better talk to the Department of Corrections and see what we can do about this $10 million.
So, yeah, he sent me the fiscal year for 2020, their calculations pretty much. So we have that to look at.
Okay, so your criminal justice reform advocates are saying there is money. People who work in corrections are saying there isn't money, and that's sort of the stalemate. Okay.
Yeah, it's weird because he said that there's 10.6 million, but corrections is telling them like, hey, we need more money. So basically, Chris told me there was advocate groups had a formula, they had a formula, and Department of Corrections had a formula. So everyone had a different formula. So they had to have a meeting recently so that everybody would get on the same formula to predict the monetary value to go into 781.
Only 4 years later.
That's what I'm saying.
Okay.
4 short years.
4 years after being in the state constitution,
Yeah.
they're going to figure out what to do with that money.
But it didn't. And that's why it's frustrating sometimes with those state questions, because if they get really specific, sometimes the people who are drafting them don't understand how state government works, or they don't understand all the finer points, and then it turns into this big hairy deal when you actually try to implement it as it's been put in the Oklahoma Constitution. That's a problem. But if you don't lay out any kind of a mechanism, you leave it to everybody's own interpretation, and you wind up with situations like this where
I think that's
everybody
what
points.
happened, because Chris said that he's had some people from the legislator say, hey, I didn't know I was supposed to do that with the money.
Yeah, some of them probably weren't there at the time.
Exactly.
Yeah.
So he said, he did say somewhat that the legislator didn't do their job, but he also said that some of them didn't know what they were supposed to do. So he's hopeful.
Well, and you could say that the reason that we had the state question in the first place is because the legislature wouldn't address these issues. That's why the voters took it upon themselves to do the petition and to force the issue with the state question.
Well, some are now. I think you alluded to earlier rollbacks, and what you meant is that there are people promoting bills that kind of sort of felonize a few things, right? Those kind of things. But
I can't remember exactly what Chris said, but he said there was 3 bills, and one of them passed and will be going to the floor, but I don't know much about those yet.
All right. And Michelle, we're back to our pandemic timeline, but really the reason I wanted to come back to that, because you had also talked a little bit to folks at Stillwater Medical, folks within the city, and not all that made it into your timeline piece, but we're still in retrospective mode, so we can still look back on those things. And just kind of the point, and I think I was making earlier, was that even if this pandemic didn't directly affect you in some way, even if you didn't lose your job, lose a loved one, or get very sick like many people did, then I don't know, maybe it wasn't real for you, but it was always very real for some people.
The people running municipal government were dealing with the fallout from this and just trying to keep it between the ditches, honestly. Just kind of keep things from getting out of control, be sure that the public was as safe as possible. And then the people at Stillwater Medical Center were just, elbow deep in it every day. They went to their operations center mode early on and stayed there for a really, really long time. And it was just exhausting. It was just a slog, day in, day out. Talking to some of the folks from SMC, Stillwater Medical Center, there were people doubling up. There were people who, the CEO volunteered to go through training and helped out, basically working as a nurse's aide on the floor when they were short-staffed. I mean, it was just that kind of thing where the communications officer volunteered to wash dishes in the cafeteria.
And I think a lot of people maybe didn't understand that. When people wanted to argue these kind of semantics about, we're really not, we have beds available. We have these kind of, it's like, yeah, but you realize people still have to staff these things, right? Staffing also becomes an issue.
Staffing became a huge issue.
And they seem to have forgotten that a lot of Oklahoma medical personnel went to New York and New Jersey when they first got hit, in April, later in March and in April, when they were getting overwhelmed in the hospitals. A lot of people came from out of state and they were just working sort of as, relief pitchers and, pinch hitters, and using baseball terms, but,
right.
Whatever you call it, they were just there to help. And Oklahoma, I don't know, Oklahoma didn't really have that same kind of response because it was also happening to the rest of rural America, sort of around the same time.
It didn't get here, for a while. I mean, everyone sort of had this idea for a while, it seemed like, that, it wasn't going to hit us really hard like it did in those big population centers, that it did in those more urbanized areas. And, it didn't in large numbers for quite a while, but I would say more so in Payne County. Locally, we got a little complacent for a while, I think. There were people working really hard to, at first we had this idea, okay, we're going to flatten the curve and then it's going to go away or something. We all thought it would be over by summer. And of course that didn't happen. And then for a long time we had, as we said, 22 cases. Well, there were counties, Washington County, for example, where it got into nursing homes. And they had as many deaths in one nursing home as we had cases in our entire county. So I think we had a little bit of a false sense of security for a while. And then you're right, by the time it caught up with us, by the time things just started going crazy here, they were going crazy everywhere else. So there wasn't really a lot of help to be spared. Having said that, we were lucky in that it didn't hit until everyone had had a chance to stock up on PPE and get the supplies they needed, because early on there weren't enough masks to be had. There weren't enough ventilators to be had. There were not enough supplies to go around. They were, looking for gowns. So there were a lot of issues early on. So we were at least able to put it off long enough to get the supplies that we needed to deal with it when it did happen. And I think everyone counts us lucky for that. But one of the things that I wish I could have gotten in the timeline was the stuff with the schools, because that's been a big impact on people's lives this year. And I wasn't able to work any of the events, where Stillwater Public Schools started the first day of school and then, never mind, a few days later, back out. And then, okay, we're going to try again. We're going to go alternating schedule. Okay, now we're back out. Okay, and now
right.
starting
even just counting, probably one of the parents could probably tell us better than what we've seen, but how many days exactly were in person before they got to do any of these things? Because their early initial triggers were population per 100,000. Orange would put you in alternating, and we almost entered in August and early September. They were kind of in orange, right? Weren't they sort of on that second tier?
Right. Well, actually, if you remember, they had to go back and change that because they started the school year and then they almost immediately went into Orange 1 because they divided it into Orange 1 and Orange 2. And when that first happened, they didn't have the mechanism for an alternating schedule yet. They had to go back and develop the AB schedule and adopt that. So at first, you just went distance learning. AB wasn't even an option until later on in the year. So I wish I would have been able to get some of that in. I need to probably go back and do like a separate school timeline and look at how many days of in-person instruction our kids actually got this school year.
So really, it wasn't this semester till there was any sustained or extended full-time in-person classroom instruction. That almost didn't happen at all in the fall semester.
Very little.
And probably not now until just a couple weeks before spring break.
Right.
Something like that.
Well, and the thing is, they were set to go back, at least on the alternating schedule at the beginning of this semester. And, we started the semester in red at the very highest alert level, because that's when everything was really peaking. So it's been a tough year on everybody. I'm just going to say that.
Well, and part of it was you try to. They were always trying to peek a little into the future, so you try to set guidelines and whatever metrics you can, and say, well, if we can. A way of doing this safely is if we can have this many students, then we can set them this far apart, right? That's part of it,
right.
And there's a lot to it. And they hadn't had any teachers vaccinated yet, those things. But once you get to these points, you're saying, fine, we're shut down. You come back to it in the spring, and you think we're going to get a little closer to being able to go in person. But we still have these same guidelines from the winter, but the parents don't care necessarily. Cram them in there, some of the parents, but yeah, so you can't really set a new policy until you set new guidelines. So they were always sort of having to try and think of what would happen in the future. Yeah.
That was a lot of it, because every time, something changed, they couldn't just turn on a dime. They had to basically adopt new protocols, and that requires a little bit of time. They would have a committee that was supposed to meet and talk about it. It included administrators, health officials, parents. It was supposed to bring all these perspectives together to hopefully come up with the best and safest option for everybody, and it just takes a little bit of time. It would take a couple of weeks, and it drove people crazy, because it just takes a while to turn that ship, right? It's a bureaucracy to a certain extent. It's there are procedures that they have to follow. They can't just decide they're going to change it.
It's been so long since we've done the math on what cases per day in Payne County would look like and what would set them into the red. But when they started, it was like 38 to 40 or something like that cases a day. That's your daily average of new cases. But we were almost in the hundreds at some point, right?
We were, yeah.
So it's like we were blowing out all these things just to a crazy extent, for there after the holidays or after Halloween, I guess, is sort of.
Oh yeah.
But I don't know if Halloween was a super spreader event, but that's sort of. The mark, whatever that holiday season was, it wasn't good.
Sure. Well, I know Perkins at one point, when I did a story about the Perkins School District and what all they did, at one point Perkins was, their community spread was at like 200 and some per 100,000. Their rate. And it's a small community, so it wasn't that many people. But when you look at the rate per 100,000 in population, it was huge. It was like 4 times the trigger for the highest alert level. So yeah, we got up pretty high in this area.
All right. So yeah, we got that coming up. We look forward to seeing what Ashlynd has reported. No pressure, but this $10 million, it's on you now. Whatever happens there. Yeah, I think that's going to do it for us. Appreciate everyone who joined us. This has been Beau Simmons, Tanner Holubar, Michelle Charles, Ashlynd Huffman. Thank you for joining us in the newsroom.